Hello, nurses all over the world. My name is Nurse Felicia, and I want to welcome you once again back to my channel. You're very welcome. And I want to encourage you to subscribe to my channel. Please subscribe to my channel, hit the like button, and make your comments. I'll be more than happy to answer any question you want to ask or any suggestion you want to make, any topic you want me to treat. Okay, so today's topic is, can somebody guess? Okay, today's topic is gout. Yeah, and is one of the common musculoskeletal problems around the world. So let's get straight into the topic. Yeah, what is the definition of gout? Gout can be defined as a common and complex form of arthritis and can happen to anyone. It can also be characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in one or more joints, and most specifically in the big toe, which is most common in the big toe, which is also known as podagra. Yeah. So what are the causes of gout? One is high uric acid level in the body. When there is so much urate in the body, then gout is imminent. The second one is having a family history of gout. The third one is it is most common in male. Being a male, it's possible that you have gout compared to the female folks. Number four is during menopause. Gout can set in during menopause. And gout is most common in people of older age than the younger folks, okay? And alcohol can also cause gout. Consumption of alcohol can cause gout because alcohol decreases the excretion of uric acid from the kidneys. And the next one is high sweetened beverages such as soda. So when you take too much of soda, you are prone to gout. And having an unhealthy diet, eating food that are rich in purines, high purine proteins. Example of these are turkey, bacon, sardine, mackerel, herring, and so on. So those are the foods that are high in purines. Let's move now to risk factors. What are the risk factors of gout? Number one is overweight or obesity. So people that are overweight or obese are at risk of having gout. The second one is people with metabolic syndrome. Example is people with high blood pressure, diabetes, abnormal cholesterol levels, and excess body fat around the waist. So this set of people can be prone to gout. And also chronic kidney disease. Our kidney is very helpful in the excretion of this uric acid that we are talking about, which causes gout. So when there is compromise in the function of kidneys, then gout is imminent. Cancer patients are also at risk of gout. Another one is rare genetic condition. After the causes of gout, the next thing is the risk factors. The risk factors of gout is overweight or obesity. People that are overweight or obese are at risk of having gout. The second one is people with underactive thyroid, abnormal level of cholesterol, diabetes, high blood pressure. This set of people are also at risk of having gout. And people with chronic kidney disease. We all know the importance of our kidneys when it comes to eradicating or excreting uric acid. And when the kidney is now compromised, then people with chronic kidney disease are at risk of having gout. Another one is people with rare genetic conditions. People with this kind of condition are at risk of having gout because they often have increased urates or uric acid. So this kind of individual, they are also at risk of having gout. The medication that can increase the risk of gout, that is the next thing that we're talking about. And the first one is diuretics. Diuretics help the body to eliminate excess fluid. So as a result of that, the urate level in the body can be increased, and which can also prone the individual to gout. Another one is people taking low dose aspirin are also at risk of gout. The next one is people that are taking niacin. It's just it's a type of vitamin. When it is taken in large quantity, those people are also at risk of having gout. And another one is cyclosporine, which is an immunosuppressant for people who have organ transplant or is approved to treat some autoimmune diseases. So if an individual or a patient is taking this kind of immunosuppressant, the person is also at risk of having gout. So let's move to the areas of the body that are often affected by gout. The joints, that's number one. The joints. Number two is bursae, which is the cushion-like sac between the bone and other soft tissue. Another one is the tendons. The tendon sheets is just like a membrane that surrounds the tendon sheets. And kidneys, because the high uric acid level can lead to stones. The organs that can be affected by gout is kidneys, because when this uric acid or urates, they form crystals which can lead to kidney stones. So when they accumulate in the kidney, it causes kidney stone. Now we move to signs and symptoms of gout. Number one is sudden and severe joint pain, which can be described as feeling like a broken bone, severe burn, or getting stabbed with glass. Their complaint is always like they have this stabbing pains. The third one is joint swelling, redness, and warmth around the joints. Another one is joint stiffness and pain with movement. So when the patient is ambulating, they're complaining of joint stiffness and pain during ambulation. Mild fever. Yes, the patient can also be having mild fever and fatigue. They often complain of tiredness. They don't feel like doing anything because of the pain. Then let's talk about stages of gout. The first stage is high uric acid stage. This is when there is built up of uric acid in the body. Because when there is built up of uric acid in the body, then the risk of developing gout also increase. People in this stage are likely to have no symptoms and are likely not to be receiving any treatment for gout. So in this category, it's just like an asymptomatic stage. There's just built up of uric acid in the body, but these people sometimes might not even know, and they are not even getting any treatment for the gout. Then the second stage is acute flare-ups. This can be defined as having reached a breaking point. So the collected uric acid that has been built up in stage one will now start to impact the function of one or more joints in the body. So they start playing out now. They start playing out, and the individual starts feeling the accumulation of that uric acid, which comes with swelling, pain in the affected joints, and the severity of this flare-up can greatly differ from person to person. Yes, so the severity of this flare-up differs. Sometimes individuals have different pain threshold. So even at this second stage, some individuals can still go about their daily activities, can still be able to manage them. Some individuals will break down and be complaining of pain and swelling. And then the third one is intercritical period. That is the third stage. After the gout attack in stage 2, then there is often a period of minimal to no symptoms. Another school of thought will say that this particular stage is just like a remission stage. Like the body is getting used to this particular flare-up or this accumulation of uric acid in the body. So it is common for a person to think that their gout has miraculously healed. Yes, I said it earlier that it can be intercritical stage or remission stage. So the body is already getting used to it, and some individual will think that, oh, my gout is gone. Miraculously, I am healed. But this is not the case. They are still at high risk for developing another gout attack like stage 2 if they do not receive treatment for this condition. So do you understand? Then the last stage, which is stage 4, is advanced gout. This is when the complications set in. After years of poor disease management, gout can develop into gouty arthritis. And people with this condition still have gout attack, just like stage 2. But during the intercritical period, which is stage 3, they will still have pain and low functionality of the impacted joints. If the individual did not go for treatment or they are poorly managed, then complications set in. And the next thing we'll be talking about is complication of gout. The first one is hypertension. A lot of things are already happening in the blood. There's high increase in uric acid in the blood, which can lead to hypertension. Chronic kidney disease. If there is built up of this uric acid, they form crystals that can lead to kidney stones. And if there is excessive kidney stones, it can lead to chronic kidney disease. Another point is obesity. And another point is nephrolithiasis, which is also known as kidney stones. Myocardial infarction can also set in. Individual can also experience congestive heart failure. This particular gout mimic other disease condition, and that's what we are talking about next. Gout mimics some condition. Let's dive into it. Number 1 is gout can mimic pseudo gout. When you hear pseudo gout, then you are still thinking about gout, but that is not the truth. The similarity between both is that both of them, they form crystals which build up and accumulate in one or more joints. They settle in one or more joints, leading to pain and inflammation. That is similarities between both. But the difference between the two is that they come down to, for gout, the crystals that gout is made up is uric acid. And the crystal that pseudo gout is made up of is crystallized CCP, which is calcium pyrophosphate. Let me repeat myself. I want you to understand. The crystal that gout forms is uric acid, but the crystal that is formed by pseudo gout is calcium pyrophosphate. So I want you to take note of that. So sometimes this gout mimic pseudo gout, but with proper diagnosis, it can be differentiated. The second one is infected joints, which is also known as septic arthritis. The similarities between the both is that there will be redness, there will be swelling, there will be warmth, and sometimes there can be fever. That's gout. And even this septic arthritis also manifests this. These are the manifestation of the both. But in septic arthritis, there is infection. Truly, there is infection. The white blood cell can spike up, they can increase. And even in gout, the white blood cell can assume the role of fighting against a foreign body or an infection, but there is no infection. The third one is bacterial skin infection, which is also known as cellulitis. Similarities between the two is that there can be fever, there can be chills, there can be redness around the area of the skin. But if there's further investigation, it will be discovered that there's bacterial agents there, which can be streptococcus or staphylococcus in that particular area that there's skin infection. But for gout, there's nothing like that. The manifestation of both can be similar. So I want you to take note of that. The fourth one is stress fracture. And in fracture, there can be swelling, there can be pain, there can be loss of function. And in gout also, this can also happen. But when X-ray is done, then it can be differentiated from gout. So the fifth one is that gout can also mimic rheumatoid arthritis. The sixth one is psoriatic arthritis. It can also mimic psoriatic arthritis. Let's talk about the nursing diagnosis. Are you thinking about something already? Can you tell me the nursing diagnosis for a particular patient that comes to you with gout? I'm going to be giving you two in this video, and I want you to add yours while watching this video. I want you to put it in the comment section. Tell me another nursing diagnosis that comes to your mind while you were watching this video. The first one is acute pain, and the second one is impaired mobility. Let's talk about the nursing responsibility or nursing role in the care of patients with gout. The first one is you encourage your patient to drink at least 3 liters of fluid every day. It's just to avoid the crystallization of uric acid in the kidney, so that this increased fluid will help flush the uric acid through the kidney, and will also prevent the crystallization of the uric acid. The second one is you monitor their uric acid level, okay? And the second one is you assist with positioning for comfort. So you place your patient in a comfortable position. Try and ensure this, because they complain of pain. Some of them complain of stabbing pain, excruciating pain. So you don't want to add to their stress. You place them in a comfortable position. Another point is you avoid touching the inflamed joints unnecessarily. So you organize your care, plan your care in a way that you don't have to go back and forth to the patient, to avoid touching the affected joint unnecessarily. Then another one is you do your health education accurately. And the first one you do is you educate your patient on the right food, on a good lifestyle. You tell them, you explain to them the foods that are high in purine, high purine proteins. And I mentioned earlier, example are turkey, bacon, sardine, mackerel, and so on. So you tell your patient you want them to reduce it or avoid this food completely because of their condition. Then you tell your patient to avoid alcohol, because alcohol, it inhibits the excretion of this uric acid when the patient takes alcohol. So you want to encourage alcohol cessation. When the patient is addicted to it, then you have to encourage the patient to start reducing it. You can't stop it abruptly. Tell them the reason why they should stop it. So we've come to the end of this topic, and I await your comments and I await your question in the comment section. So until then, bye.